No use of the word contraction. Staff must be invited in by the mother. Hey guys, welcome to Nurse Talk, the podcast where we talk all things nursing. My name is Mia, and today I thought it'd be super fun to do some labor and delivery nursing stories because I'm pregnant. I am a NICU nurse, so I hear, all the good, the bad. And so I might come across some stories that it's like, well, why would you torture yourself like that and read that? But I unfortunately already have heard a lot of horrible things. So we're already well past that. We're going to be doing a part 1 and a part 2. So after this, please keep a lookout for part 2. So for part 1, we're going to be doing a nursing Reddit thread called L&D Nurses, what is the craziest and most bougie birth plan that you've seen? Before we get into it, don't forget to like and subscribe. Okay, first one. I don't mind a solid birth plan. Problem is, parents don't realize the baby is the one with the plan. Bingo. That is completely true. That's why I think it's so important to not really have a plan, because you really do not get to decide at all. You can go in there with a plan, and I think it just makes it harder for you when things turn. It's like, okay, you need an emergency C-section and you were really, really stuck on a vaginal birth. I've seen terrible outcomes from that. So I think, just know the baby will just decide for sure. Okay, next one. I guess mine was a lovely Orthodox Jewish couple that I had cared for previously who were having their second baby. She had a uterine rupture attempting a VBAC. I was written up after the husband went to administration because her head wrap came off rushing to the OR. They brought a menu for a kosher restaurant and wanted meals delivered and charged to the hospital. That was approved. Wow. I had to call the formula company at 3 a.m. because the father refused to allow the nursery to feed 10% for a low blood sugar unless it was certified kosher. And then they set the room curtains on fire, lighting the Shabbat. I'm not sure what Shabbat is. I'm going to Google that real quick. I hope I'm saying that right. Shabbat. Candles. In Jewish tradition, the connection between Shabbat candles and childbirth involves two main customs: adding an extra candle to honor each new child, and a historic postpartum practice where the husband lit the candles instead of the recovering mother. Okay. Well, I think that's a beautiful tradition. However, then they set the room curtains on fire, lighting the Shabbat candles that they had been told they were not permitted to do.
By lighting it on fire.
Okay. They wanted meals delivered and got it paid for. That's also crazy. Probably because they didn't offer kosher, that it wasn't all inclusive. And then I had to call the formula company at 3 a.m. because the father refused to allow the nursery to feed for low blood sugar. Okay. So what was this dad planning to do if the formula wasn't certified kosher? You would rather your baby be poked and prodded, and no. Some people just get it. This couple sounds crazy, and no thank you. I don't want them as my patient. Someone commented, meals charged to the hospital? What in the actual... You know what? You can guess what I just said there. The entitlement on some people is crazy. And I don't really see why the nurse actually got written up. Like, it's one thing that the family went to administration. You can't control that. But that administration actually wrote her up for it. I think I'd want a new place to work. Anyway, We'll go to the next one. Being induced for preeclampsia with severe range pressures with a closed cervix, but only wanted to use a peanut ball as an induction method. No, honey, we have to get the baby out now. I don't know. I share, my NICU stories, but I don't know if I could be an L&D nurse. I really don't think I could. I've seen some things as a student, or orienting as a nurse, either one. You get to do your rotations. And I didn't get many because I was in school during COVID. But I did get some L&D time right before, everything shut down. And I saw quite a few. I saw like 2 or 3 C-sections, which was, whew. The first one I saw, I started sweating and I almost passed out. I was like, no. And then I did see a few vaginal births. And I was like, I don't think this is for me. And it was funny because I originally, when I was, applying for nursing school and doing all, I was like, I'm going to be an L&D nurse. And then I saw it and I was like, no, I'm not. That's okay. Okay, let's read the next one. I'm very talkative today. Okay. Had a patient who wanted rose petals spread out on the tub. The unit had a water birth suite. Yes, she was sectioned. I don't hate anyone for wanting a particular birth. I don't have a problem with people wanting minimal intervention births, so as long as they are respectful towards the staff who are working towards a common goal. Someone said, sorry, the best we can do is the dried up pepperoni left from the pizza boxes. Oh my gosh. Okay, next one. I've seen a few that don't even apply to current circumstances. Those ones get irritating. For example, the patient came in with a plan that said no IV, no continuous monitoring, yes epidural, yes trial of labor after C-section. Not only are those things incompatible with each other, the patient had never had a C-section, so she didn't even understand what her requests meant. That one took a lot of education. Okay. I don't think people understand that almost every patient in the hospital has an IV. It is genuinely for your protection and it's really not invasive. Of course, there's a little metal when you insert it, you take it out, it's just a little piece of plastic, a little plastic catheter, and it can absolutely save your life. Even if you're on a regular med-surg floor, and it may depend on the facility you're at, but a lot of them demand that you have to have peripheral access, meaning you have to have an IV. If you code, then give you life-saving medications, and it really does help. It's really, really important. When I did med-surg, you had to have a special order to be on the floor that said you did not need an IV, and that was very rare. Okay, so when you go in for birth, which can end up being very traumatizing and life-threatening, please don't come in saying that you don't want an IV. That is crazy. And no continuous monitoring? What about your baby? Do you not want us to be able to see if your baby is okay? If your baby is handling birth? Sounds a little crazy to me. And you want an epidural, which is way more invasive than an IV? Make it make sense. I want to know how long that education actually took, because good thing when you're an L&D, which I've heard, I've never worked in L&D, I've heard you only have 1 to 2 patients, so thank goodness for that. Can you imagine? You have 6 patients and one of them is like, I don't want to be monitored, I want no IV, and I want to be on an epidural. Okay. I'll be in here for 5 hours explaining the most basic. Never mind. Okay, next one. Not an L&D nurse, just a nurse who had a baby. I remember going in and the nurse asking if I had a plan. I said, yeah, get this baby here safe, whatever means necessary. Ended up having to go for a C-section, but I didn't care. She got here healthy. And that is exactly my plan. Couldn't have said it better. Someone commented, I try like crazy to follow birth plans. I go over the plans with the parents step by step. Usually the thing we can't do: no IV, intermittent monitoring, family catching the baby, no postpartum pit, immediate discharge after delivery. Once I explain that they need the IV if they want an epidural, they are agreeable. But I did have a mom recently who wanted the epidural, but also wanted to walk the halls and deliver standing up. Well, how do you plan to deliver standing up if you can't feel your legs from the epidural? Interesting. Someone commented, why are intermittent monitoring and family catching the baby not allowed? My hospital offers both. Rural hospital, one group of providers not on board. Okay, someone commented, there are hospitals that do walking epidurals for their laboring patients. I think it's a terrible idea, but it does exist. I've never heard of that, but again, I'm not a labor and delivery nurse. Someone commented, may I ask why it's a terrible idea? I'm a layperson and genuinely enjoy learning from nurses on this sub. They said, so at least for us, once you have an epidural, you are considered a high-risk birth, meaning you have to have continuous fetal monitoring and monitoring of the mom's vital signs. Epidurals can cause blood pressure to drop, and if mom isn't perfusing blood, then the baby will eventually decompensate as well. They also cause a decreased sensation of the lower extremities, meaning that she would be at much risk for falls. An epidural is also a tube that is left in your spine and has numbing medicine continually running into it. In my experience, that tubing isn't very long, so if you were walking too fast or fell over in the hall, you would displace it and have to sit for a new one. Ooh. Next one. Lights off the entire time, clocks covered, whispering only. No use of the word contraction. Staff must be invited in by the mother. All this on top of the standard crunchy mom plan. She ended up screaming and cussing down the halls on postpartum because she didn't believe the nurses needed to check her baby's blood sugars and left AMA. You see, where people have just no freaking knowledge about anatomy at all. So they just think you're doing this stuff for fun. So you think I'd rather come in and poke your sweet baby than go do anything else? No, you have to do it. It is for their safety. Having staff having to be invited by the mother is actually ludicrous. Clocks covered, lights off. Maybe she's just trying to set the, the scene, the woosah scene, but having staff must be invited. Okay. Okay, next one. When my nurse asked what my birth plan was with my second baby, my preeclamptic ass answered, safe mom and safe baby. I'm glad I went into it with that mindset because we had truly emergent running down the hall with me on a gurney, decision to baby within 5 minutes, C-section. I don't understand the opposition to medical intervention, but maybe that's because I'm a neuro nurse and I see how terrible an outcome can be. Yep. Some people are so against medical intervention that it costs their baby's life. Truly. I've seen it time and time again, and it's really sad because those people genuinely want the best for their baby, but they just don't understand. And that's unfortunate. Someone commented, I remember my nurse asking me if I had a birth plan, and I looked at her a little confused and go, to deliver a healthy baby. And she was so happy. I'm sure she was. She probably took a deep breath and said, it's going to be a good day. My baby has kicked like 100 times during this, and it's super cute. Okay, next one. I had a lady come in for an elective induction at 1800, so 6 p.m. Her birth plan included if baby not out by 2100, which is 9 p.m., 3 hours later, must cut out with C-section by 23:59, so a minute before midnight. Wow. People know that labor can last a couple days, right? They got 3 hours. Wow. Okay. Next one. Do not speak directly to me. Speak to my doula only. And don't offer me anything for pain under any circumstances. You might regret that. Wow. Okay, next one. Like a lot of people say, most plans have blended for me. My whole thing with birth plans is that 99% of the time they include things like keep the lights dim, or listening to calming music, or be free to move in labor and push in any position. I know I'm lucky because we are a pretty progressive unit and I want you to move. In fact, I will reposition you myself every 30 minutes if I have to. And I've listened to everything from Enya to Eminem in the delivery room and could not care less. What gets me is that people have these requests and do not check to see if some of the stuff is even possible at the hospital they'll deliver at. I'm glad you want nitrous as pain management, but does the hospital have that? We do, but I know not everywhere does. I think it's great that people take the time to think about what they'd like, but part of making these decisions should be seeing if your desires can be met where you're giving birth and how important that particular thing is to have. And should you find somewhere else to be able to meet your needs? With that being said, the best birth plan I've seen from a coworker who made a joke one. I wish I could find it, but it was hysterical. It was things like no water from the water machine. My husband will cut the cord by chewing on it. And in an emergency, I prefer a rough C-section to a gentle one. Oh, I like this person. They came off pretty sweet. I agree. I don't think like the calming music and dim lights would be a problem, but yeah, if you come in there demanding something and they don't even have it there, it's like, okay, we don't have it, so yeah, and we're not gonna have it delivered for you. Okay, next one. I'm not an L&D nurse, but I worked as a medical assistant in a midwifery-led birthing center. My favorite birthing plan ever was to reserve the right of the birthing person to kick anyone out of the room who had off vibes. Okay, next one. My OB and my nurses loved my birth plan. I even printed it. Birth plan. Get baby out, breastfed, give baby all shots, interventions, make sure they're okay, drugs, give me all the drugs. Delayed cord clamping wasn't on my list because it's something my OB does with every patient. Yeah, that's a great birth plan. Next one. I'm not an L&D nurse, but my bestie from nursing school is. She said one patient wanted to have an orgasm during birth because she heard it could happen.
Ew.
That's disgusting. Why would you want that tied to your baby? That's creepy and weird. Ew, don't like it. Got the heebie-jeebies there for a second. Okay, next one. I'm all for a birth plan with minimal interventions. You want to go natural? Let's do it. My issue is, don't come in for an elective induction and then not want to be induced. Aha, there you go. You don't want pit, or Pitocin it's called. You don't want a cooked balloon. You don't want us to break your water. Okay, so what do you want us to do? That, and if you do plan on going naturally, be prepared at least somewhat on how you want to manage your pain. I also hate doulas that try talking the patients out of the epidural when they change their mind and are losing their ever-loving mind. I had a doula telling the patient to bear down and do what your body needs to do at 4 centimeters. Her cervix was swollen to hell after that. Of course. Girl comes in for an induction, doesn't want an epidural, and also doesn't want any pit or a cook to be induced. She's 4 centimeters and wants IV pain meds, but doesn't want to be on the monitor. Absolutely not. How do you... Okay. So you want us to give you like morphine and all of that, but you don't want to be monitored? You know that it affects your baby too? Okay. Her pain tolerance was next to nothing. Our CRNA has to numb her with lidocaine just to get her IV. This girl also yelled at us to get something other than our hospital gowns because they were ugly. Oh gosh. My only hope is she doesn't decide to have another because she was a nightmare. Who cares? These people are crazy. Some people invest all of their energy into all the wrong things. Okay, well, those birthing plans were pretty interesting. I will certainly not have this type of energy for my birth at all. Anyway, I hope you liked this video. Please keep your eyes out for part 2, where we are going to read some scary L&D stories. I hope you have a wonderful day. Don't forget to like and subscribe, and I'll see you soon. Bye.